Hey, good afternoon, everybody. Eric with American Business Systems here, welcoming you to our Wednesday webinar. Folks, you are in for a treat today because we've got some great new information to share with you about an article that just came out this last week, and you're going to just love it as we are going from 2019 to 2020 on talking about starting a business in healthcare and learn why doctors will want to work with you. So we are going to talk with you about 10 different topics today. Again, all brand new information. Just so sit back and enjoy the time that we're going to have with one another. All right, so let me tell you real quickly about American Business Systems. It's amazing that here in 2019, we were just wrapping up celebrating 25 years of being in business, and actually, be celebrating 26 years, and within 4 years from now, it's 30 years. So what a wonderful time that this has been for American Business Systems, and we keep growing and adding new things and adding ways to help you build your business. So it's very exciting. Again, for those of your first time on the webinar, my name is Eric Auger. I'm just part of what we do here at ABS, whether it's marketing, whether it's education, whether it's these webinars. I'm here, and I'm here to help talk with you. So if there's anything you need, feel free to reach out to any of us. We'll be happy to do that, happy to talk with you. As you're doing your due diligence, go check us out at the Better Business Bureau at Fort Worth. You'll see that we have an A+ rating, so you're always going to want to do that type of checking. Let me introduce you to our founder and CEO of American Business Systems. That's Patrick Phillips. He and his wife, really over 25 years ago, started their billing company. And I bet you that's going on for at least 30 years there. But he's also a best-selling author. He's written several books. I'm sure he's in the middle of processing some more books and co-authoring with some of the other folks that work with us here at ABS. But the one that we're going to talk about today, you'll see The New Thriving Medical Practice. So that is a great book that you'll see to help you with your marketing. But he's also a contributing editor to the BC Advantage magazine. So Patrick, without any further ado, let's get you on over here because there's a ton of information we're going to try to get through here. So it's good to see you, sir.
Yeah, good to see you. Wow, when I first glanced at my video there, I thought I was in my pajamas. You can't see it, but I'm actually in a logoed shirt. There, I'll tilt it up where you can see that. That's our logo. But I look like I'm in my pajamas here. I am in an upstairs office here in my home, and so it's a little different view from behind here. But hey, Eric, I see a lot of folks here that did not put anything in the question box. They may think this is a recorded webinar, but we'll prove it to you if you type something in there. Alex, Bradley, Denise, Eunice. Let's see, you mentioned a few other. Rogelia, did I say that right? I don't know.
I hope you did, because I think I may have.
And yes, Noel. Okay, so anyway, hey, and Nevin, by the way, is on here. Nevin is one of our business development coaches. I just was reminded, but when I saw his name, that we will be talking a little bit more towards the end, how that you should be talking with Nevin and some of the other people that are here in our offices, what we call business development coaches. They'll help you develop your business, that is, help you do your due diligence, get you all that you need and all the answers to all your questions. We'll talk more about that here towards the end.
You bet. I am getting for everybody here on the webinar, I'm getting the printout there. So everybody just bear with us. We'll get that up there, and we'll get this up here and running. But in the meantime, let me put this back up here, and let's talk real quickly, Patrick, about one of the associations that everybody can be associated with once they become a licensee of American Business Systems, and that is the MRMA organization. Why don't you talk about that real quickly?
Yeah, that stands for Medical Revenue Management Association of America. Now, Eric, I know that's just a screenshot there, but could you go back to the actual website just for a second? I'd like for you to click on the About Us, and I think there's a thing right under About Us called Advisory Board. I want you guys to see that this is a legitimate organization that certifies you once you've gone through our training. They actually give you a certificate that says that you are a certified medical revenue manager. That means you can put CMRM after your name on all your literature, business cards, website, and so forth, because it is a recognized certification by MRMA that you've completed our training. And our training, by the way, never ends. Once you're a licensee of ABS, we have webinars on a regular ongoing basis. So here's the website that Eric has gone to live now. He's going to go up to About Us, and you can go check this out yourself, myrma.org. And you'll see that we have Dr. Vicki Rackner on here, which we'll talk a little bit later, and several other partners, and even some of our licensees that have been with us for years have been invited to be on this advisory board. This organization, folks, oh, and there's a famous guy right there. You see Eric's face? He's on here as well. That's because we only invite the people who really, really, really understand our industry, that will help you. We've got a LinkedIn group out there for Myrma. It is a wonderful organization that you automatically become a member of once you have gone through our training. Now, folks, that means you will be a member of the nation's largest network of independent medical revenue managers or medical billing companies. So to be a part of that is pretty important, and that's just a part of your certification through us and through Myrma once you've gone through our training. Now, we'll talk a little bit about this, folks. This is not a sales pitch. We don't ever sell people on this. We're hoping that you're just doing your due diligence and wanting to know more about it. We're hoping that you're typing lots of questions in the question box today so we can answer those live for you. But once you've done that completion of your due diligence, we'll get you scheduled for your live online training one-on-one with one of our certified instructors, and get you out there. Because, Eric, do you realize that we're in December? The first of the year is just around the corner.
I'm telling you.
Anybody thinking about starting a business, guys, this is the time to get it started so that you can hit the ground running in December. You literally have time starting today to get all of your training done by the end of this month and be certified and ready to go and just rock it out there.
You bet. You bet. Now, I've got up here all different services, and a lot of these services we're going to be talking about today, obviously about the revenue cycle management and Code Write and Quick Collect and EMRX. But what I thought we'd start off here with is, now, Patrick, I know that we've used this in the past, and this is not getting any older than what it is, but we know that from Black Book ranking, they have stated that 87% of all physicians state that they prefer or have a preference for a single source for their revenue cycle management and their EHR software, which means they're looking for a solution that is a software solution that is not pieced together. You want to talk about that real quickly?
Good point, Eric. And hey, folks, now here's why we bring this up. There are companies out there similar to what we do. They train people and support them on being medical billers. But we train you to be a medical revenue manager, which is way beyond that. You'll see why today as we go through the webinar. But the reason this is important is because I'm telling you that there's no other company that I know of out there, Eric, that has a true single source vendor. That's one technology company that has developed their revenue cycle management software, which is the billing software, and the EHR, the electronic health records, all in one. And folks, you'll see on the next screen here that we actually have done that. We've developed something, as you can see, it all looks like it's a part of the same software. It is. It's all written by the same software programmers that we have in a room out in California. And there's a lot of guys out there that just eat pizza and drink Pepsis all day long.
Yeah. Yeah, and it's a great group of guys and gals that have technology experience. But even further than that, what it's led by, originally it was designed by a couple of doctors who know what they wanted. So it's not like you just got a bunch of nerds going, hey, I think a doctor might want this. This is actually driven by doctors for doctors. And one thing that we know, Patrick, there's not an EMR system or a medical billing platform system that a doctor loves 100%. But this is about as close as we're going to get, because it does a lot of the things that doctors said, man, I wish my system did this. It may do it a little differently than what they expected, but it does do it. And that's why it's working all together. And that's why what you're going to see here in just a moment, and we go through these 10, what they call the top 10 things that are challenging doctors going into 2020. This is one of those things that actually solves one of those problems.
So if you're talking to any other company besides ABS about getting into this business, be sure and ask them this question. Was your software, your billing software and your electronic health record software written by the same programmers. That's about the only way you'll get an honest answer out of them, because some of them have private labeled some open source EHR out there on the market to make it look like it's theirs. That means they've pieced it together with bubble gum and baling wire, as we say here in Texas. And that
Right.
means that sometimes it works, sometimes it doesn't. If it doesn't, guess who they're going to blame? The other company. So a single source is what 87% of all doctors want. That's why it's important. You'll have an advantage in the marketplace if you're offering something that really does have truly one source for all of it.
Yeah, and you can
talk about all the different things that it does there. Look at this.
Yes, yes, and as you're going to see here, you just have you kind of take a mental snapshot of just this one screen here. Again, as we go through the rest of this webinar, because you're going to identify the importance of having all of this in one location as we're talking about. And a lot of people want to know, if everybody kind of follow with their eyes kind of down the right side of the screen there and all the way down the bottom where it says specialized. What that means is that it can be specialized just to any type of doctor, whether it's a family doctor or a dermatologist or a podiatrist or a urologist. It can all be specialized for that particular specialty. So it really is a system in which can be very, very helpful. Patrick, we've been kind of just tinkering around with the top 10 challenges facing physicians in 2020. And as people can see, this is dated December the 10th. I think that was just like
yesterday. Yeah.
Yesterday. So it's like we couldn't have gotten any fresher information for you than what we have here. And this, you can see, this is done by the medical economics. And folks, that if you're on the call today, and those that might be listening a little bit later, I would go bookmark this on your internet browser, because medical economics has a ton of great information for you to utilize, especially when you're doing some of your marketing. It just so happens that it's one of the resources that we like to look at because it kind of ties in with everything else we're doing. So this was written by the entire medical economics staff. So what they've done is that they pulled it from all of their departments and said, hey, give me the top 10 challenges that are facing docs coming up. Here they are. And Patrick, I think we ought to just get started on them right now.
Yeah, look, here's why this is important, folks. If you're looking at starting a business, you want to get into something that you really believe has a future, right?
Right.
Eric, I can't think of any reason why healthcare would go away. That is, as long as there are human beings who get sick, who go to a doctor, the doctor has to get paid by somebody, and someone has to bill the entities, the insurance companies, and the medical, the government agencies that actually pay the doctors. Somebody has to do it. Now, can a doctor do it in his own office with his own software, his own staff? Yes, but you'll see today why there's some advantages in outsourcing their billing to someone like yourself. So let's jump right in there, Eric. Starting at number 10, aren't we? Yeah.
We're going to start from 10 and work it all the way down. This first one here, and everybody see at the bottom, and then also I was able to drop the handout over into your handout, so you've got that. So you'll have all of this information in front of you. But you can see their top 10, starting with number 10, hiring quality clinical staff. You know, Patrick, you and I were discussing this before we got on the webinar today, and this is kind of like, gosh, what does this mean, and what solutions do we have that can help a doctor hire quality clinical staff? It's not so much that we've got something to help them hire, but it's taking their quality clinical staff, people, that's your MAs, their nurses and everything else, and giving them and focusing them on what they do best, which is practicing medicine.
Yes, helping patients to get well. But the big thing here, folks, is that doctors could, like I said earlier, they could hire somebody in their own office to do the billing, but why would they do that when it's going to cost them? Well, as you can see from this chart here, we've compared outsourcing the billing might cost the doctor about $28,000, $29,000, let's say. But doing it inside his own office, because they've got hidden costs for all the things you see listed there. And again, I encourage you to download the slides so you can study this more carefully. This is just based on 1.5 people in the office helping the doctor with the billing, which is typical, right? 1 to 2 people. And so we've been very conservative in these numbers. Eric, 65, is that 80? That's 65,000, right? That the doctor would pay inside their own office when they count all of these hidden costs behind the scenes. So there's one way we can help doctors if they're concerned about hiring people, they should be hiring people to help them see more patients. That's where they make their money, not in doing the billing. They've already
Well,
they've already earned their money when they've seen the patient, right? Now it's just a matter of somebody actually helping to get that money in for the doctor.
right. And what a lot of people, they haven't, and nobody's asked this yet, so I'm going to ask the question and kind of answer the question for you, but it does get asked. Well, if I go in there and they've got a biller, and I'm going to take some jobs away from people that are actually already working with the doctor's office. Well, that's what we're talking about. If we can, let's say that the doctor hired a medical assistant and maybe a nurse, and now that nurse or that medical assistant has now been tasked to do medical billing or collecting, putting in patient payments or doing something like that.
Very common.
That happens. And so what happens is, I'm going to go back to this screen here, you've taken quality clinical staff and now you've assessed them and put them over into administrative staff, and therefore you're losing and you're limiting, as you can see here, you're limiting that where that doctor's limiting in their practice growth. And so getting that out of their office, getting the medical billing out of the office and getting those people who are the nurses, the MAs, and get them refocused back up on the medical side of everything, they actually get better healthcare, they get better healthcare results. Their patients are happier because they're being seen in a timely fashion. This is what we're talking about here. And that's one of those top challenges that the doctors kind of need to refocus. And those are some of the things that through Cynthia and the training group and the support group actually can help you through as you're talking to doctors and possibly bidding out for their business.
Right. So folks, let's go back to the purpose of this webinar. It's to help you make a decision as to whether getting into medical billing for doctors is the right business for you. And so as you can see, this is what ABS is good at and have been for 25 years. Eric and I have been doing this together for about 10 or 11 years, and that is doing webinars that instruct you and educate you based on things. This article came out yesterday. That's how up to date we are in keeping you up to date on what's happening in the industry, and being able to convey this information to doctors makes you look like the expert. And that's what they want to do business with, right? And as an expert. So
and that's just what we do for you as a potential licensee of American Business Systems.
Right.
We don't even have time to go show you the licensee support side of all the current things that we put out there with current.
There are literally hundreds of hours of webinars that we've done over the years. And we literally do 2 or 3 a month for our licensees.
Yes.
And we're doing one this Friday, by the way, Eric. It's an open Q&A. We've had the licensees email us their questions, and we're going to have licensee guests on the webinar. We'll probably have 4 or 5 people on this one. It'll be like a live TV interactive panel answering these questions for licensees, and we'll take questions live during that. Now, we usually do those on Friday, but folks, we record all of these and post them out on our private licensee website, so you can go and watch them anytime you want to. So it's just a wonderful way to continue and keep you up to speed, make you feel like you are a part of something really, really big.
Right.
And it is. We're the largest network of medical billing companies out there.
All right, let's go to number 9, because we certainly don't want to run out of time. But there was one question that came in, and I think that was, let me answer that before we get too far off of that. Glolis. Yeah, Glolis is asking, is the system able to bill for pharmacies as well as one of the specialists? And the answer is yes. And here's just a qualifying question that you need to ask your potential client. Do they bill on a CMS 1500 form? If the answer is yes, at that point you can know that you can bill for them. Pharmacies bill on a CMS 1500 form, so you're good to go there.
Right.
Negotiation better contracts. Patrick, it's, as we kind of read through this, we have to kind of get down into these bullet points for us to really get involved of where one of our specialties, one of our services that are being used to actually help with that. Everybody go all the way down to the bottom where it says involve your coders in eliminating payer specific barriers to getting paid for certain codes. We have that service to help them get, they won't even know if they need to negotiate better pay without coders. And guess what? We've got a coder program there for the doctors. Let me get to that one there real quickly. I know that we've got that pulled up there. and it's right there for Audit Guard. Audit Guard, what they do, or what Audit Guard, the system does with Audit Guard, it actually reviews the doctor's charts for possible coding errors, and it stops those coding mistakes. It helps improve the reimbursements. Patrick, these services that we have for ABS, and people that have never been in medical billing, you already have a complete coding team behind you already.
That's right. Well, that's one of the questions that people ask us, of course, is do I have to be a coder? Do I have to know about all those codes? Because they've heard maybe of friends who've gone through some training and maybe gotten certified as a certified medical coder. Folks, there are thousands of these codes. But the great news for you is that as an ABS licensee, using our cloud-based system, we have all those codes built into the system. It will actually suggest the codes that you should put in for the doctor if they haven't given you this specific code. So it's all up to date. It's kept up to date on a regular basis. You could log in tomorrow and there would be new codes that we've uploaded overnight. So There's no updating of the software. You don't have to worry about keeping it up to date. It is up to date by the minute.
Correct. Yeah. So the audit, there's actually two parts of this with Audit Guard. Audit Guard is, again, it's a review. It does those checks. It'll start to identify whether the doctors, their contracts that they have with their insurance companies are within the area of reimbursements for that doctor. But then also we've got code right, like Patrick said, that is all part of this. And this is the ongoing. So if you find the problems, now you can add code right in there for the ongoing part of it. So it really is just an incredible, wonderful service that, again, will help to figure out for these doctors, are they losing money? In negotiating for better payer contracts, you have to have a coding audit. And again, folks, if you think about this, the doctors should be going through a coding audit annually. Now let that kind of sink in a little bit, because that could be the thing that gets you into the front door. And we're going to show you one other thing that we know definitely is going to get you in the front door. And this is some of the things that we're doing behind the scenes for our licensees on a continual basis. And like the webinar that we're doing today, we actually have these get our licensees in front of the door and into the doctor's office past the glass done webinars already for you. It can't get any easier than what we're actually making it for our licensees, Patrick.
Yeah, and hey, talking about better payer contracts, folks, that's not something you have to get involved in, but we're showing you that you can get in the door and talk with the doctor because they're all concerned about making as much money as they can, right? So one of the things we showed just a second ago, Eric, if you go back to Quick Collect there, we'll just talk about that for just a second. This is something that can replace the doctor's need for a collection agency, because only 50% of all the bills sent by doctors to patients are actually paid. Eric, that's horrendous. If you were just a regular business, you wouldn't put up with that, right? But doctors do. They don't have to. With our service, we can collect a huge portion of that, and it's all a cloud-based system. You don't ever make any phone calls. You don't even mail anything out. It's all done automated behind the scenes. So it's a wonderful another service that you can offer. Cybersecurity. Hey, there's a good reason to have. We get questions about a cloud-based system, right, Eric? So I just want to address that just for a second.
Sure.
Everybody's worried about the security of a cloud-based system. Actually, folks, if you think about all the big players, everybody has stuff in the cloud now. In fact, Apple has its own cloud. Prime, Amazon has their own thing. Microsoft has their own cloud. That's because if it's done correctly with the right security things in place, it can be much more secure than just having the data on your computer. Imagine, Eric, some software out there by other companies, our competitors, that software resides on your hard drive inside your computer.
Right.
And so does the patient data. That is very dangerous. If that computer is stolen or lost or burns up in a fire, all that data is gone unless you know how to back up, nightly. With our software, you never have to worry about that because it's on various servers in various parts of the country, automatically backed up off-site every night, and it's redundant, meaning if one server went down for some reason, the other one just kicks in immediately, and they're mirror images. So anyway, I just wanted to touch on that because I know people wonder about that. We've never in 20 years had any breach of our security because it's all HIPAA compliant, meaning The HIPAA has looked at it, the government has, and said, yes, you're compliant.
Well, that's one of the services that we have, and kind of just flipping back between this screen and going back to here, you can see this is one of those things that are facing. Now remember, folks, this is a top 10 list of things that are facing doctors going into 2020, and hackers are one of those big ones. And we have a very, very specific service that handles that, and that is Compliance Guard. Now, folks, let me kind of give you a peel back the curtain secret here. If you're wondering how you're going to get an audience with the doctor or with the office staff or the office manager, I'm going to give you a little trick and a tip how you're going to do that. Imagine that you're with ABS already, and you've got this flyer and another flyer for a webinar that you're going to invite that office to, specifically on HIPAA compliancy. And what you're going to do, you're going to take that information, you're going to walk into that doctor's office, you're going to knock on their door, do whatever you got to do, and say, hi, whatever your name is, I'm here to see your compliancy officer, and don't say anything else. I promise you, you're going to get a visit from the office manager, and you're going to have a dialogue with them quickly.
Yeah, they'll go get that office manager immediately because they don't know who you are. And when you're talking about a compliancy officer, that sounds scary. They all know that they're going to be looked at carefully by Medicare. They're gonna audit them at some point, just out of the blue, and we have the perfect solution to that with Compliance Guard. Now, folks, we don't have time in this webinar, of course, to go into all the details about these, but we'll show you towards the end of the webinar how you can get more information about this. There's some on our website, but there's much, much more behind the scenes. We'll show you how to get that later.
Okay, and then we've got number 7, reaching patients with chronic conditions. Now, folks, we know that Patrick and I we well know we are above 55 years old at this point in our lives. We have chronic conditions. So the older that we get, this whole baby boomer thing is happening, and we're in it. And we've already hit we're in that 10,000 per day group. So we know that that's happening. Right. But how can the doctor reach patients with this? Now, we've got another service that actually helps with that, and that's called Audit Guard. Patrick, why don't you kind of share about how this actually works, and it drives more traffic to the doctor's office.
Eric, if this were a software that was not out there, I would have it written and invented. It's fantastic. Now, you can't tell from looking at this screen, folks. It is cloud-based, meaning you just log into the website for it, and it actually lets you send out, though, a physically printed full-color greeting or postcard.
Right.
And that means that you can personalize every one of these cards for your business to reach out to the doctors, and you can market this service to the doctors so that they can reach those patients that they need to be constantly in contact with, the chronic patients that are out there. So It's a wonderful system. There's over 15,000 different cards that you can pull up on your screen, change it any way you want to, put your name, your logo, even photos of the doctor and their staff. This is a marvelous system, Eric, and I wished I had time to go into all the things that it can do for not only the licensee's business for reaching doctors, but also to help the doctors reach their patients.
You bet. Yeah. Number 6, avoiding lawsuits. Now, folks, I mean, these doctors are so worried about lawsuits. Now, whether it's coming from HIPAA issues, you got to think about that. We just talked about HIPAA issues, and that's just one aspect of it. But then you got the whole medical malpractice lawsuits that can happen there. And you can see 4 ways to protect yourself are, number 1, look what it says, document everything, which means if you're going to document everything, you got to store that documentation and have a way in which you can pull that up. Now, again, one of those ways that we can look at that again is utilize Audit Guard to make sure that these doctors are actually taking care of all of their different codes and keeping up with their different charts. And they need a system in which they can store all that. Patrick, they can store all of that, again, in this one cloud-based system called iClaim EMRX with the clearinghouse and the patient portal.
That's right. No, they can get away from paper completely, folks, and make all those documents available to all of their staff, even off-site, even after hours. They can access this and get to any one of the documents that they want to about the patient. And then there's the patient portal, which allows the patient to even upload records that they've gotten maybe from another doctor into the patient portal so that that doctor's office can now access all those records too. It's just I wish we had time to go into all of this, but folks, as you can see, we have the practice management system, the billing software. We have the EMRX, that's the electronic medical records, and we've got the claims submission scrubber clearinghouse built into our systems, which we'll illustrate here in a minute. And then we have that patient portal, which we'll talk a little bit more about too, because it's pretty exciting, all the things you can do in that patient portal.
You bet. Number 5, we're halfway through this thing, and then you can see here, caring for yourself. Now remember, this was put together by Medical Economics, the top 10 things that are facing doctors as they go into 2020. The biggest thing that we see is doctor burnout. And you're going, what could ABS possibly have as a service for that? I'm going to show you that we have something better than a service, and that's Dr. Vicki Rackner. Patrick, you want to talk about Dr. Rackner, and then we're going to go out to her website and showing some of the things that she's actually doing with some doctors already.
Yeah, Dr. Rackner and I have written a book, which Eric showed you at the very beginning, called The New Thriving Medical Practice. Now, that book is more than just a book that doctors want to read because they want to thrive. It's a book that you can use as a marketing tool. We'll show you later how you can put your name on the front cover of that book and your contact information on the inside, all printed as a paperback book. Yes, you can order it on Amazon right now if you wanted to. But she's also written a book called Dr. Burnout. That's coming up real soon. And here's her website that Eric's going to tell you a little bit about.
Yeah, so this is Dr. Rackner's, basically her personal website called thrivingdoctors.com. But underneath that, if I'm going to go right up over here where you can see where it says coaching, I'm going to click on coaching, and as you can see here, would you like to prevent and treat burnout? So you can see that she can have a complimentary 15-minute phone call with your doctor. Imagine having Dr. Rackner helping you set up for you, and she could be talking about any of these things, attracting more patients, proactively managing your online presence, their online presence, how to market out there without being salesy. Folks, this is what Dr. Rackner does for you with us here at ABS. I mean, Patrick, you found her, and you two connected. It's just amazing what you guys have been able to do and what she's been able to do for ABS here.
And folks, you basically, when you become an ABS licensee, you partner, because of ABS and our partnership with Dr. Vicki, you partner with a doctor. Now imagine you starting a business that is a business based on approaching doctors with a doctor as a partner. She even writes you a personalized letter on her letterhead introducing you to the doctors in your area. And as I said earlier, you can put your name on the front cover of that book, the second one you see up there in that tiny graphic, The New Thriving Medical Practice. Your name can be on the front cover of that book with Dr. Vicki Rackner. So it just doesn't get any better than this. It positions you perfectly as the person that the doctor should be doing business with in their area.
You bet. And like what we said right up here, partnering with Dr. Rackner will give you the advantage. And as a retired general surgeon, Dr. Rackner knows Dr. Burnout. So you couldn't have anything better than to have, and how does she put it, Patrick? She actually says, whenever a peer can talk to another peer, and then that peer introduces that peer to a medical billing company, you talk about, you go from the bottom rung of like bottom feeders to way up here of having such a wonderful introduction, again, by Dr. Rackner. It's you can't really, I don't think there's no other business opportunity that gives you these types of tools other than ABS.
Yeah, and you know what? I know some of you have been on these webinars before, and you've heard us talk about these things, but sometimes it takes hearing things from a little different aspect. It takes oh, forgot to turn off my phone on my computer here. It takes hearing it from us several times, maybe, for this to sink in. Let this one really sink in, folks, because talking about being having advantage in the marketplace, this is your secret weapon right here, being partners with Dr. Vicki Rackner. She's well known all over the country. She speaks at doctors' conventions. In fact, she's traveling today to one, Eric.
Yes.
And of course, books are all over the internet. She's very famous consultant for doctors. Okay, number 4.
Look at this. We're in 2020, Patrick, and EHR came out, what, 10, 12, 15 years ago?
Yeah.
I mean,
Yet
look at
the usability and
yes,
interoperability, that means it communicates with other systems, is still a big concern of doctors. Now, Eric, we have the solution for that. We are answering that for all the doctors that are being signed up every day from coast to coast by our licensees. And that's because our EMRX is the one that was designed for a tablet or an
yes.
iPad.
Yeah, absolutely. And here we've got a just a quick little screenshot of this, and you're going to hear us a little bit later talk about if you haven't seen this, you need to see an online live demonstration of the whole EMRX iClaim billing platform and how it all connectivity works together.
Right.
But here again, if you go back over here, you can see they got a clunky EHR interface with a lack of communication between systems, create serious challenge for physicians, including harm to the patient care and contributing to their burnout. So, another way to help that burnout is to actually have a good EHR. We've got a great EHR. We feel like we've got the best one out on the marketplace for you as a licensee to present to doctors. And again, you don't even have to do the live presentation of the demo. That's something that our team here at ABS Support actually does for you.
Yeah, and look at how beautiful that is, Eric. I mean, it was ingenious for them. The programmers actually programmed this for the iPhone before the iPad even came out. And so then all they did was adjust the dimensions, of course, to fit the iPad. It also works on any tablet running under any other operating system. This is platform independent. So you can use Windows computers, you can use Samsung, Android phones, it doesn't matter. But it's designed specifically for doctors to interact with their patients face to face without having to turn around to a laptop or a computer.
Staying with this whole frame, number 3, increase competition. Now, the doctor's competition is getting stiff out there. So what is it going to take for a doctor to separate themselves out from everybody else? You can see easy online appointment settings. We've got that. Streamlined paperwork allows patients to fill out forms online prior to visits. We have that. Minimize wait times. Use software that texts patients on wait times and when they should arrive. We have that. And one thing that's not included in here, but you can see evening and weekend appointments at the bottom, we've got one step better than that, and that is beat the competition with what we say as the leading e-visit technology. iClaim Patient Portal Telemedicine. There is no need for a third-party service for telemedicine. It's already built into the system, Patrick.
Yeah, in fact, that illustration there is showing a computer screen, as you can see. That is the electronic medical record system, our EMRX, we call it, that the doctor is using on his computer. Well, look, the patient can use their phone or iPad or computer to actually interface with the doctor through video. Folks, this is the future. There is not going to be a visit to a doctor needed in about 90% of most cases, they say. That is, the doctor does not have to touch you to figure out what you need from just your description, or you could show them, okay, I have this boil on my arm, here it is. It doesn't matter. But telemedicine is the future, and we've been there for several years already, all built in.
Everything built in.
Again,
Bradley,
what's your advantage in the marketplace? That's what we're talking about here. And as Eric said, this is, talk about competition, there's nothing like this out there.
Right. And if it's nothing like there for you to market yourself to the doctors, think about it what it is for the doctors. Remember, the doctors have to market themselves as well. We've already showed you through Audit Guard that that's one of the ways they can increase getting patients in there with some chronic issues and reminding those patients that have that. And then a telemedicine e-visit built right into the system. They don't have, imagine going out to a third party telemedicine, and there is one out there that actually sells a franchise out there with that. Imagine trying to have to then connect that with the doctor's EHR system. Well, that's where you run into those connectivity issues. This is already built inside of it. So
yeah. Hey, by the way, Eric, I'm just going to throw in that Bradley says he has to go to a meeting. He says, I'm interested in learning more, but I have to go to a meeting. So, folks, this is being recorded, and you'll be sent a link because you registered for this to the recording, and you can watch it and show it to a partner or a spouse. So
there you go. All right, number 2, getting paid. So remember, just kind of remind you, these are these big things that doctors are facing come 2020. And accurate documentation, coding are necessary to avoid denials and ensure proper reimbursement levels. Making sure, and this all goes into what we talk about as the revenue cycle management of a doctor's office. So everything from coding, we've already talked about coding, we already have a solution for that. But then again, making sure that the doctors are getting paid. Now is a great time, Patrick, because we're going from, again, at the end of 2019, going into 2020. Guess what's happening? All the deductibles get reset, and guess what happens? All these deductibles have to be met again. Choice pay is designed to help that entire process and make it very smooth for the doctor and the patient to get paid, paying those deductibles.
Yeah. So folks, if it's dawning on you that there's a little bit more to just medical billing than just preparing the bill and sending it out, there is. But these are all optional services. You don't have to offer these to your doctors, but you'll find out that these are things that give you the advantage in the marketplace over your competition. So that's why we've made these available to all of our licensees. And this one's a great one because, Eric, we collect up to 98% of the money that patients owe to the doctors versus that 50% I mentioned earlier. And you just mentioned denial rates. Eric, let's talk about rejection rates because some clearinghouses out there have rejection rates up to 35%.
Yes.
Ours is less than 2% on the initial rejection rate. Less than 2%. That means more of those are going to be paid. And that's what we're talking about here, getting the doctor paid.
Right, and we're going to illustrate that here in just a moment. So we still have the best part of it still to come. But as we're talking about the different services, whether it's choice pay or they're in quick collect, instead of taking what I call it just a bad practice of sending patients to collection agencies, quick collect helps avoid those doctors from having to send patients to quick collect, to collections. They can do it through quick collect, which is a much better solution, much better customer service to that patient. And again, this is where Patrick mentioned earlier that 50% of accounts receivables just kind of go away and never get collected. Why not use something like a service like that to help get those doctors collected?
And again, you're not involved in that at all. You're not making phone calls. You're not even sending out anything. This is an automated online cloud-based system that works behind the scenes automatically without you even having to think about it.
And then part of, again, getting paid. I'm going to go back over to that screen here about talking about getting paid, and then go back over here to where we're ending on this whole part of it, and that is, what about hidden nuggets? Where the money could be just right in their office and not even adding anything. You're going to get through a discovery called the Practice Revenue Report that is designed to discover lost revenue. And Patrick, let's kind of dig into this because we've got a little bit of time here. And these numbers really is what gets a doctor to move. It's not because you're good looking or handsome or beautiful or anything else. It's the bottom line. They'll move because it's the economics are there for that.
Well, and a lot of people think you have to be a quote salesperson to market this to doctors, but folks, you're going to see, let's zoom into that, Eric. We're going to see that this actually does all the selling for you. So now, folks, I know that depending on your computer and whether you're on a tablet or a phone or something, I know it's small or hard to see, but zoom in, adjust the screen, go full screen, whatever you need to do to be able to see these numbers because they're real important. I'm going to do that myself, Eric, because I can barely read those myself. But look, this is part of the report that you'll be able to prepare with our help, of course. Our support department will help you get this started. And once you've learned to do it yourself, of course, it's a snap because you're just dropping in numbers that the office manager gave you when you did the initial interview, what we call the practice analysis. Right. And as you can see, this starts with the number of claims that are filed monthly, in this case, 300. And the average amount, it says, according to this particular practice, was about $100 per claim.
Sure.
Now, their approximate rejection uncollected claim rate right now is 25%. Eric, is that uncommon?
That's not uncommon.
No. There are licensees who told us, and we've seen their reports, that are up to 50, 60%. Unclaimed. Now, that's because some doctors do see so many patients and the bills are coming in, the claims and the payments and so forth, that they don't track this like they should. we're going to be able to show the doctor exactly how much money is owed to them and what the rejection rate is. So basically, if you look down the line there, you see that the monthly practice revenue right now is $17,500 based on their current volume of claims and rejection rate. We're going to take that up to $27,000. Eric, isn't that about, that's about $10,000 a month increase, isn't it?
Yeah, I mean, if we look down there at the very bottom, monthly increase of $10,200 and $10,202, which is a 58% monthly increase, and another $120,000 a year plus. So again, like Patrick said, you don't have to sell anything. You just let the numbers do what they have to do. They may ask you, well, how do you do all of that? Well, that's the question you want them to ask, which again will help you lead them to a live demonstration, which we do and handle for you. So,
Eric,
yep.
I happen to know that $122,000 would buy a nice Tesla Model S.
Exactly.
And folks, are a nice vacation for the doctor and his family. I don't know what you'd do with that. Or maybe he wants to buy new equipment or hire new people, expand his practice. There's all kinds of reasons why doctors are struggling nowadays, folks. And it's based on that bottom line figure, how much money they're bringing in.
Yeah, you bet. And it's all, again, driven by what we're able to do with iClaim. We couldn't get to those numbers if we didn't have tools in which would get us there. And iClaim is that tool because, again, it's the only one that's out there that has, as you'll see here in a moment, we got one more illustration or a couple of illustrations we want to get you on. But we want to get to this last one, and that's administrative burdens. And Patrick, I think as far back as you and I have been doing webinars, this has still been one of the biggest issues for doctors, and that is the administrative burdens.
It is just running the business of a medical practice. Folks, they weren't trained to do that in college. Believe me, all of them will tell you, a doctor will tell you that doctors are the worst business people there are because they're so focused on helping patients and learning new information and so forth, keeping up with what's going on, that they just don't know how to run it as a profitable business. Well, if they don't, guess what? They're not going to be in practice very long. So this is a big burden for them. We ease that burden for them in one real important way. And that is we can take every piece of paper in the doctor's office and scan it in. That's, with your help, of course, you're helping do that. That's how you get paid for it, into an online cloud-based document workflow management system. Now, here's what that means, folks. It means they can run their entire practice without one single piece of paper. They literally could take everything into the cloud, and it's all searchable. They can scan it, they can retrieve it. It's all HIPAA compliant, and it is a wonderful, powerful document management system, and it helps them with their workflow inside the office as well.
You bet. And I want to go back one more time to this and kind of read through this again so that everybody gets it here, because there's so many. Each one of these top 10 that Patrick and I have talked to you about this during this webinar, there's so many services that could actually help that in many different ways. We just showed you one with the iDocs Now, but then let's kind of read through this. You can see that one of the physician's administrative hassles and regulatory requirements are the biggest challenge, and that's the need for prior authorizations being a very common complaint, which means that is actually handled in the iClaim system. So imagine that we're able to help that doctor automatically check insurance eligibility, and then once they've got that in there, then they can make sure that they've got prior authorizations that they get reimbursed on, because again, if they don't get those, then they're going to find out that they're not getting paid. And so there's a lot of different things here. So whether it's the iClaim platform that helps these administrative burdens, whether it's the iDocs Now that helps get these things taken care of with these issues that the doctors are faced with. Folks, we have just taken the last 40 minutes. We've stepped through 10 different things that doctors are faced with going into 2020. Patrick, whenever I first started with you over almost 12 years ago, I thought, well, we're going to run out of things to be able to do and help launch these new businesses. It's not stopping. It almost seems like we're finding more things that we can actually help doctors with, obviously, and help our licensees with.
Well, just like here recently, we did a webinar for our licensees that they invited their doctors and office manager prospects to. We did the webinar
Yes.
for our licensees. It doesn't get any easier than that, Eric. We're doing all of the marketing for the licensees. Basically, all they did was invite people to come to those, and then follow up, of course, with those people once they've seen the webinar. So we just constantly come up with new ideas, and we're geniuses.
You almost have to say, I agree. It really is, because folks, we've just shown you top 10 challenges that are being faced for physicians come through 2020. What we have as a complete package, as you can see here, we've got a patient portal that the patients can online before they even leave the house type in all of the reasons why they're coming to see the doctor, which feeds into the EMRX down there, which when the doctor is seeing you as a patient, all of that information goes into the iClaim. Whenever it's time to do the billing, it's going through the internal clearinghouse in there, which you can see it's going from there directly to the insurance companies. It's hard to explain within about 60 seconds, as I just did that. So I want to encourage you again to get with your business coach, get with somebody here, and go through a live demonstration of the software. We'll be happy to take you through it. You'll ooh and ah about it. The doctors that we've done these far, they ooh and ah about it. And I tell you, one of the hardest sales about this is not necessarily the doctor. It's usually the office manager. And about 10, 15 minutes into this, the office managers are going ooh and ah themselves. So
Yeah.
we can get them there to a point where you're starting to hear some what everybody wants to hear are buying signals from the doctor.
That's right. Eric, I think the number that I heard last was we're closing and wrapping up deals with doctors for our licensees about 50% of the time when they see these live demos. So that means, folks, that you have a huge advantage over any other company that's out there. Not only will we help you to find out where those doctors are and how to connect with them, but we actually do all the presenting, answering all the questions. It's all live. You can be on there as well, of course, as well. You'll hear exactly what they ask and what we answer. And then sometimes all you have to have is the paperwork ready for them to sign, literally.
Yep, absolutely. Patrick, I want to also invite everybody to ask some last few minute questions. We've got about 7 more minutes before we shut down the webinar. So if anything we've talked to you about today has got piqued a question for you, feel free to get that into us. Before we get to the last of everything, and maybe even start taking some questions, let's kind of us do a wrap up here. And let's talk real quickly about what our guarantee is about, because sometimes this can be a little confusing, but it's one of the best money back guarantees in the industry whenever it comes to business opportunities and franchises out there in the market.
Well, yeah, the only reason it's confusing, I guess, to people is because they can't hardly believe that we would do this. My
Right.
staff even thought I was nuts when I first came up with this idea. I said a few years back, look, if we really have what we believe is the best business opportunity in America, then we should be willing to offer a complete 100% money back guarantee. If somebody goes through our training, you've basically got 30 days and you don't like what you see for any reason, you get all your money back.
Yeah.
I call that taking the risk out of making the decision. So folks, be careful. Any other company that you invest in, any franchise or business opportunity that's out there, if they don't offer a money back guarantee, they don't believe in what they're doing. Now, we have actually given people money back, right, Eric? It's happened a handful of times over the years. So it does happen. But folks, that should tell you that your chances, I think that's probably less than maybe 1% of all the people who've gone through our training. Less than, it's 0.5%. It's very tiny. That's because, folks, we have, and we show you and let you see all the proprietary information that we have during that training period, during that 30 days, and you have access to all of our online resources, all the webinars, the hundreds of hours of recorded webinars that we have. All of that's available to you through that entire period. Now, how can we do that? Again, it doesn't happen that often, so we just feel good and we can sleep at night because we've said, okay, that's your decision to make, not ours.
Right.
Okay, so Eric, I don't see any questions coming in, so we might as well just talk about the online training.
Yeah, let's talk about this because we made a switch this year. We went from live training, having you fly in here, to online training, which I think it's one of the best moves we made because, again, it gives you a couple of great advantages. Number one, you don't have to go anywhere. You get to see it, over a 1 to 2 week period of how long it takes you to get through, and you get this one-on-one with the trainer. I mean, again, this helps you for the questions that you have to kind of go, and then it gives you opportunities to go actually test it while you're going through your training.
That's right. Yeah, we used to have people fly down here for a whole week. They'd come in on Sunday. They'd be at a hotel where we did the training for a week. Friday, they would be gone by about noon. So it was a good 30, 35 hours of training. But folks, this training that we do now, well, this is the future, obviously. Everything, you can take the college courses now online. So we decided, look, there's no reason for people to fly down here and take a week off of work and so forth. They can do this training on their own schedule. So folks, as soon as you get the agreement done with ABS and your funding done, all of a sudden you have access to everything, including the training with you. Again, it's live, it's one-on-one, not in a classroom situation. This is you and a live instructor going for an hour, hour and a half through about 8 different modules covering everything there is to know about the business. Now, that's not where the training stops, of course, but at the end of those 8 modules, you do get your certification as a certified medical revenue manager. Then you can go on to our live training that we do on a regular basis, reviewing, updating, giving you new information, new ideas on marketing and so forth. That's, like I said earlier, 2 to 3 times a month we do that for our current licensees. And there's no additional charge for that, folks. Our one-time licensing fee of about $27,000 is all there is for you to invest. You never pay another penny to ABS, not for upgrades of the software, not for support, not for training, nothing else. By the way, Eric, I just mentioned the price of the package at $27,000. You know that that's going up soon.
Right.
Very
right.
soon.
Very soon.
You need to get back with your person who invited you to the webinar and do the following steps. First of all, you need to research very carefully. And one of the ways you do research a business is to get our research guide. We'll give you the phone number here in a moment if you don't know who your business development coach is, but it's the person who sent you the email. You can just reply to the email inviting you to this and tell them you want the research guide. That's a 50-page PDF document that has all the information and the details about our business. Then be sure and look at our YouTube channel. Eric, we've got hundreds of hours of training out there, don't we?
We do, yeah. I mean, just tons of more information. So if you want to go back and revisit, go back and listen to some of the testimonials or some of the interviews that Patrick has done. Go back and watch some of those. Now, we're going to share with you in a moment what we're doing for next week, so you're going to want to sign up for that. And then one of the things that we encourage you to do is talk with other licensees, find out what they've done. And again, there's no better way. I mean, like Patrick and I have said this before. Patrick and I can tell you just whatever we like to tell you about on these Wednesday webinars, but talk with the licensees. I mean, because they're going to talk with you about what went right, what they did, what they could have done differently, and that helps you to make sure that you avoid some of the pitfalls that they may have made. So please talk with those licensees, and we cannot stress enough the live demos, Patrick.
Oh, you just don't know what you're missing if you haven't seen the live demo of our system. Once you've seen that, folks, we've had people very on the fence and not sure, and maybe they were going to go with some other business opportunity, company or franchise. And when they saw the demo, they said, okay, I get it now. I see what you guys are saying. This is the future, and we have the solution for doctors who are looking for an easy way to manage their revenue.
Yeah. And then get a hold of your business coach that you're working with and just have them send you the purchase agreement so you can review it. Have your attorney or CPA look it over and just work on your funding and all that's in there. And again, there's some folks that are on the webinar today that you're kind of thinking about, do I get this ready for 2019, 2020? Right now might be a good opportunity for you to go talk to your financial planner or your tax preparer, everything. Do I make this purchase now because it may be a better tax write-off for me for 2019? Do I wait till 2020? Just talk that through. You may find it be best to do it now, or maybe in the next couple of weeks. You just don't know, but we're right at that thought process for you to kind of talk with some of the people that you trust, which might be your attorney or CPA. So what we want you to do is give us a call, schedule a live demo, or get your copy of the research guide. I've kind of put this up here so you can kind of know what it looks like, because Patrick was talking about it. Patrick, let's kind of talk. We're up at the top of the hour already. We're already over.
We'll put the phone number back on the screen there as well, so you can call in if you'd like to and ask about who your business rep is. If you're not sure, just go back to the email, if you can find it, that invited you to this webinar. That's the person that you need to get back with, and that's the toll-free number you can call there if you want to as well. Eric, thanks for putting this together. This is fantastic information for people looking to start their own business. Folks, if you've been wondering, what can I do working from home in my pajamas, like I am today, this is the business. It's great, Eric. My wife and I actually, back in the early 90s, when we were doing the medical billing at that time for doctors, we were actually running this out of our home. So we built a new home. Our relatives asked, how did you afford that new home with all that new furniture? And we said, well, we just work out of our home here in our pajamas. So that's how we got started. People ask us, well, how did you do that? What were you doing? And the more I found out that people were interested in how we did that, I thought, well, there's probably a market for teaching people how to do that. That's how the company started. That was, well, again, 25 years ago.
Yeah, absolutely. All right.
Hey, I see a lot of folks on here we did not acknowledge. Alex, Christina, we got Ciante, we've got, I think I mentioned a couple of things there, and then Marcella. Yep. Folks, thank you for taking the time out today to watch this. It is a wonderful way for you to educate yourself. If you're not ready to make a decision and move forward, and maybe you don't have the funds put together or whatever, just continue to be on these webinars every Wednesday. We've been doing this for what, Eric? Like you said, 10, 12 years.
Yes.
So we'll continue doing these educational webinars, educating you on what the best business is to get into, that we believe in all of America.
You bet. Everybody, y'all have a great evening, and remember, download the handout, because this is a great webinar. This is recorded. You're going to want to come back and watch this one over again. So we'll look forward to seeing you on next week's webinar. Thanks so much, Patrick.
Yeah. Thank you, Eric. Appreciate it.
Bye-bye.